So my name is Vina Hulamm, and I'm one of the co-chairs of the WFPHA Working Group on Global Health Equity and Digital Technology. I'm also the international liaison at the American Public Health Association, working with the WFPHA.
Hi, my name is Tim Mackey. I'm a professor at UC San Diego and also a co-chair of this working group. And I'm also the director of the Global Health Policy and Data Institute.
So I was motivated to work in public health when I first came to APHA. So my background actually was in international development, and I had been working in consulting for some of the companies in Washington, D.C. And when I switched to APHA, I started to learn more about public health, as well as all of the different areas in public health.
I got motivated to work in global public health based on pretty much my background living overseas. So as a young child, I lived overseas in the Philippines, Germany, Greece, and other countries as well, including Japan, and just getting exposed to a large number of people and populations. And all of the commonalities between these populations was that health is so important. So I was really interested in identifying how I could have an impact in kind of the public health space, but more broadly, global health as a discipline started to come about at the time I was doing my master's program. So really interested in this new field that was interdisciplinary, and it included a lot of different scholars and different methods of how we can better human health.
So I've been associated with the WFPHA since I've started working at APHA. So at this time, it's almost been about 18 years.
I've been associated with the WFPHA since I first presented at the 2012 conference in Ethiopia. And since then, I've been coming to conferences here and there. And now as the co-chair, I've been at WFPHA in that role for the last 2 years.
So our working group has been focused on some key areas. As a working group, we are trying to support a global forum for our members and partners who are interested in health equity and digital technology. We also seek to advance knowledge and research among our National Association members to support their needs and interests in becoming more engaged in this, emerging and very important area of public health, and also work on, as a working group, develop evidence-based policies that strengthen WFPHA's position on digital health and health equity, and hopefully also guide the Federation's advocacy to create more political will for change and adoption of these policies. Some of the current activities that we've been working on as a working group, we were engaged in the 17th World Congress on Public Health in Rome last year. We had three workshops, one on digital health innovations to improve health equity. We had another one in collaboration with the WFPHA's Indigenous Health Working Group on human-centered design approaches to developing digital tools that enhanced Indigenous health. And then we also had a workshop that addressed the infodemic from a health information equity lens. We also had 2 sessions at last year's APHA annual meeting, looking at the intersection between digital health and health equity through technology and innovation. And then we also had an online digital workshop that, in collaboration with the Women, Children, and Youth Working Group, focused on digital health for ending preventable maternal and newborn deaths and achieving health equity for birthing people and newborns. And then at the Consortium of Universities for Global Health at the conference, Tim led a satellite session with the WHO's Special Program for Research and Training in Tropical Diseases and on global health communications, discussing health equity principles and digital technologies. And then we also engaged in the Global Health Equity Global Public Health Week of the WFPHA. We had an infodemic management masterclass, also another event on maintaining health security, strengthening health workforce capacities for infodemic management, and then a COVID-19 health information innovations for the future, which was an online course organized by the Spring School on Health Information. And then other collaborations with the working groups through young professionals working on a systematic review article, looking at health and digital literacy with new technologies, looking at generative AI, as well as misinformation. And so some of our future activities, we continue to want to engage with the other working groups and exploring other collaborations with the WFPHA's other working groups, and then looking at other external engagements and collaborations with other groups and research opportunities as well. Based on what I've described as far as what we've been working on so far, I think our activities hit several of the goals of WFPHA's strategic plan, particularly goal number 2, contributing to promoting systems change and decolonizing global health. As you've seen through some of the work that we're doing with the Indigenous Health Working Group. Goal 4, developing and advancing public health knowledge, education, practice, and research. And we're doing some of that through our collaboration with the Young Professionals Working Group, as well as the sessions that we've been having and the workshops that we've been having at these global conferences. Also, Goal 5, growing and strengthening new partnerships with groups who share our values. We are doing that especially through the members that we've been engaging with, the National Association members, as well as Goal 6, strengthening and supporting member associations. Our working group actually are selected members from representing low and middle income countries as well as high income countries. So we are trying to bring in members that represent all the geographic regions, as well as young professionals to senior professionals as well. I think WFPHA's ties with WHO and with the regional alliances that we are working with as well are helpful. This is in addition to the national member associations, but engaging with those groups as well as the other working groups, I think all of those networks are very helpful for us to expand our network and also get more of the other members engaged in expanding, and enhancing the activities of the working group. And hopefully we'll be able to do more than what I've described. But our hope is that we will also be able to reach out to potential donors and seek funding to support some of our activities.
The working groups have been a great place for people to come together and talk about shared challenges in the global health space that can potentially be addressed by digital tools and digital technology. As Vina mentioned, we have a broad and diverse group of people who are part of our working group that we purposely selected from all around the world, and multiple different income groups, like low to middle income countries, low income countries, and high income countries as well. So getting perspectives of those members of how they've actually used technology in public health to improve health outcomes, what challenges they're experiencing, and what new technologies may be, innovative in the space of public health practice. So those are all areas that the working group really helps us with, because it gives us these diverse perspectives that we may not have access to. And also, as Vina already mentioned, we have some great working groups that we can collaborate with that bring in the perspectives of young professionals, of people from indigenous populations, and people that are really focused on addressing maternal health. So our working group, at the pillar of our discussions and our activities, is addressing the digital divide and making sure that technology isn't just for innovation purposes or for profit purposes, but actually to advance equity components. So those fundamental principles are built into kind of the mission of the working group. And as a quick example of one project we're working on, we're looking at digital health literacy by doing a systematic review with young professionals. And we're trying to determine what are the different avenues for digital tools to improve digital health literacy, also taking into account this digital divide that's occurring all across different countries. So this is a very practical example of how we're using the practice of inserting health equity into principles of digital technology, and making sure that when we develop digital technologies, equity is one of the core principles we use in order to develop that technology. So another thing that we're exploring is the idea of co-design sessions with young professionals and racial and ethnic minorities and people from diverse backgrounds to really be part of the design of digital tools, so that they have those equity principles built in, and they're built in a way that people actually will use them and enjoy them. So again, one of the greatest opportunities that we have here at the working group is to liaise with other working groups at WFPHA. We've had a longstanding partnership with the Indigenous Working Group, which is doing some great work in Indigenous data sovereignty, which is this concept that Indigenous peoples have the sovereignty to own, manage, and control their data. And this is a really important initiative. We're working with them and how to build tools that are compatible with this principle of indigenous data sovereignty. And again, we're working with the Young Professionals Working Group to really focus on how young professionals view technology and what their role is in identifying equity principles that can be designed in them. That includes a project where we're looking at the impact of generative AI and large language models and how they will impact the practice of medicine, pharmacy, and public health. So these projects are real-world examples of us collaborating with different working groups, building collaborations where we have shared unique experiences around public health and digital health, and also, generating research that we hope will advance the field in this space.